The humerus or arm bone is the longest and largest bone in the upper appendage. You'll notice that it articulates proximally with the glenoid cavity of the scapula. At the distal end, it articulates with two bones of the forearm, the radius and the ulna. So let's begin at the proximal end, and then we'll work our way down until we get to the distal end. At the proximal end, the structure that does form the ball and socket joint, known as the shoulder joint or glenohumeral joint, is the head. The head of the humerus is a rounded, smooth surface with articular cartilage necessary to form a nice ball and socket joint. Moving just distal, there's an area known as the anatomical neck. Then distal to that, there are two knob-like structures known as the greater tubercle and the lesser tubercle. The greater and lesser tubercle are attachment sites for muscles. When we get to those rotator cuff muscles of the shoulder, many of them are going to attach to these two knobs in order to move the humerus. Moving distal from those, there's another neck known as the surgical neck, shown here with the dashed line. In between the tubercles, I failed to mention that there's a groove in between, known as the intertubercular sulcus, or groove. Inter, again, means in between the tubercles. What lies in between those tubercles is a tendon. It's one of the two tendons of your biceps muscle, which is found in your upper arm. Okay, let's now move distal from the surgical neck, and we will reach an area about midway down the diaphysis known as the deltoid tuberosity. The deltoid tuberosity, as the name suggests, is an attachment site for a muscle known as your deltoid muscle. The deltoid muscle is a large shoulder muscle that helps to move the humerus. The major action it has on the humerus is to abduct it. Abduction is moving the humerus away from the body. A tuberosity is typically used to describe a rough surface. And you can see here that there is a roughening that occurs at that location. That allows the muscle to attach. At the distal end, there are two main structures that form joints with the two forearm bones, the radius and the ulna. The structure that articulates with the radius is known as the capitulum. Capit means head, so this is another head-like structure. It is round right here versus the trochlea, which begins here all the way to here. So you have the capitulum, which articulates with the radius, the trochlea, which articulates with the ulna. Trochlea refers to its groove-like structure. That groove-like structure is reminiscent of a pulley wheel. Trochlea means pulley wheel. Those are very important structures at the distal end of the humerus. Just proximal to them are what's known as epicondyles. An epicondyle is above a condyle. Condyles are large structures for articulation. In this case, it's the capitulum and the trochlea, which are the condyles. Located just above the condyles are smaller little bumps, not for joints, not to form a joint, but to allow muscle attachment. There's a medial epicondyle and a lateral epicondyle. A lot of our muscles of the forearm attach at those epicondyles. The medial epicondyle you can palpate. You can feel on the inside of your elbow joint and feel that bump. Sometimes we call it our funny bone. So that's the humerus. You'll notice that there's a lot at the proximal end and there's a lot at the distal end. There's always a lot of structures when there's formation of a joint. Let's move right into the radius and the ulna. Rule number 1. The radius is lateral, or thumb side. The ulna is medial, or pinky finger side. The radius at the proximal end has a head. Its head is somewhat flattened. It's more like a disc shape. What that disc shape allows it to do is actually spin on the capitulum when you turn your palm over. The head of the radius has a neck, the neck of the radius. Just distal to the neck of the radius, there's another tuberosity, a rough surface, known as the radial tuberosity. The radial tuberosity is an attachment site for your biceps brachii muscle. That biceps brachii muscle allows elbow flexion. When you bend your elbow, that is primarily done using your biceps brachii muscle. Moving distal, we notice that in between the two bones, the radius and the ulna, there's a membrane. This helps kind of hold them together, known as an interosseous membrane. At the distal end of the radius, there's a styloid process. There's a pointy process. I also want to make a note that the radius is much wider than the ulna. When we get to our carpal bones, we'll notice that the carpals, 2 of the 8 carpals, articulate with the radius. The ulna actually does not form a joint with any of the carpals. Let's move back up now and look at the ulna. Posterior on the ulna is the olecranon. Olecranon means elbow. So the point of your elbow is actually the ulna. It's the olecranon of the ulna. At the distal end of the ulna, we see that there's also a styloid process on it. So both of these forearm bones have pointy projections at the distal end. This is a better view, a closer image of the 3-bone articulation that we see at the elbow. When we get to joints, we're going to learn that there's actually 2 joints located in your elbow. There's the hinge joint, which allows flexion and extension. There's also a pivot joint that allows rotation of the radius. And that's how you would turn your palm over, which we call pronation. But we see again the articulations that are occurring at that elbow region. We have the capitulum, the trochlea on the humerus, the capitulum articulating with the head of the radius, and the trochlea articulates with the ulna. There's actually a notch here on the ulna known as the trochlear notch. You'll notice that there's another structure known as the coronoid process. Coronoid means crown-shaped. This little pointy feature here is known as the coronoid process of the ulna. Back here in the posterior side of the ulna would be where you would find the olecranon, the point of the elbow. This is just the proximal end of the ulna. Again, it's useful to look at many different views of a bone to better understand some of these structures. Here we see the olecranon. This U-shaped structure here is the trochlear notch because it articulates with the trochlea of the humerus. There's also a radial notch. The radial notch is a little surface where the radius articulates. If we go and look at the previous slide, that radial notch would be right here. So now we see that the humerus articulates with each bone, radius and ulna, but the radius and ulna also articulate with one another. At the distal end of these two bones, they also articulate. So back here would be the proximal end. They articulate with one another. Here they articulate. The radius has an ulnar notch. So notice quite often the notch is named after what bone attaches to it, not the bone that the notch is on. So the ulna had a radial notch up here. The radius has an ulnar notch. We also see a surface here where two of our carpal bones will be articulating. The scaphoid is going to attach here on the radius. The lunate is going to make contact here on the radius. Those carpal bones and metacarpal bones and phalanges will be a topic of the next lecture.